Hello, everyone. Welcome to the BioTouch Center. Tonight, we're having a workshop on oral care. So sorry. I'm a month ahead. On elderly care. Wow, good start to the night. Tonight, we're having a workshop on elderly care. So welcome, everyone, especially those that are watching us via live stream. Tonight, our speaker is John Abraham. He has 40 years experience as counselor, therapist, patient advocate, and healthcare administrator. He is here to discuss with us how the medical system deals with the elderly and how you can make sure you get the care and treatment you want. So, John?
Thank you, Sherilyn. Thank you all for having me. Let me turn off my cell phone here. There we go. Trying to think what would be most helpful to you. In my experience, more often than not, maybe not necessarily always, but as we get older, our health declines rather than improves. And for the last 9 or 10 years, I have been volunteering almost full time with a group called Final Exit Network. That is a Right to Die group, a Death with Dignity group, and excuse me. And we offer several programs here locally. Our most well-received program is what we call advocacy training. The advocacy refers to for you advocating for yourself regarding the medical system, and or whoever has medical power of attorney for you. The advocacy training is very thorough. It's 4 hours long. I'll try to sum up some highlights tonight, but it consists of role playing and a video demonstration, about 40 pages of handout material. And basically, I call it advocate. It's all you're all familiar with advanced directives, living will, and that sort of thing. It's important that you fill out the Arizona state forms. Those things are all state specific. And I know, for example, 5 Wishes is a big one that's out there. Most of the hospices use it. Don't use it. Use the Arizona health forms. It's called the Life Care Planning Packet, and it's found at the Attorney General's website. So the legal term in Arizona for somebody who does have power of attorney for health care for you is either healthcare agent or surrogate. Other states call it a proxy or an advocate. I call it advocate. And the training is basically teaching people how to make damn sure that they get the care they want and don't get what they don't want in terms of any kind of medical treatment. Many that we deal with is regarding end of life, but it's for any time you encounter a medical institution. And these days, a lot of doctors practice defensive medicine. They'll run all kinds of tests without even asking you sometimes, and of course bill you. So it's important that you fill out those forms, but more important than that, the forms in and of themselves are not that helpful. And even if you have all those forms filled out, all your I's dotted and all your T's crossed, often your wishes are still not honored. So it's important that you have a good advocate, somebody who knows you well, knows what you want, knows what you don't want, in your corner and with you when you're encountering the medical system. It's important also to review those forms annually, and at least annually, and at least sign or initial and date them again, so that this proves, particularly if you want various treatments withheld, and that shows that these are consistent, rational wishes of yours. Okay. The folks I deal with, many indicate they don't want, for example, artificial hydration or nutrition. Okay. Uh, that one is not always honored, and more insidious than that, one thing that happens these days is they spoon feed you. They may not hook you up to a drip system for hydration and nutrition, but they'll try to spoon feed you. And even if you don't want it, it's a reflex. You see the spoon coming, your mouth opens, and so it's kind of force feeding you, if you will. That's just one example. Any questions at this point? No?
So can you, in these directives, ask for what you want?
You can, yes, you can ask for what you want, of course, yes.
So if I want something like BioTouch or
Yes.
an alternative therapy, I can put that in a directive.
Absolutely. And it's important that you explore all kinds of different options. And if surgeons are suggesting surgery, always get a second opinion, you know. Search out whatever might work best for you, and have your advocate in on that too. Trying to summarize my 4 hours of training here. But you can specify, I do not want to be spoon fed. But even with that, you need somebody with you to make sure you're not being spoon fed. The folks that we work with are they're considering the possibility of hastening their death, and oftentimes they do want things withheld, and that's difficult because the whole medical system, in a nutshell, is geared to keep you alive no matter what. Slowly it's getting better, but for many doctors, death is a defeat, and the system is geared to keep you going. And if you don't want to be kept going, just prolonging death instead of enhancing the quality of life, that can be an uphill road. Hospice. We always recommend hospice care. Now, some hospices are better than others. And in Tucson, there are way too many of them. I helped start the 3rd hospice in the country. I've started others after that, done a lot of consulting with hospice workers and with hospices. And I have a handout if anybody wants to contact me, you can contact me through BioTouch on how to choose a good hospice. And when it comes to the end of life, most of us want to die at home. Only about 20% maybe of us will enable that to happen. And one of the things I teach people is you don't have to stay in the hospital. You don't even have to be there. You may have to sign a release saying you're leaving against doctor's orders. And if you do so, Medicare will still pay. They'll still pay the hospital bill. Whether your private insurance pays or not, you have to consult with your private insurer. Some may not if you leave against doctor's wishes. But a lot of my folks, they don't want to die in the hospital. They want to be at home in comfortable surroundings with people they love, perhaps touching them, perhaps not, as they wish. And that's another factor. And most of those with whom I work are elderly. Not all. We have people in their 30s and 40s, 50s, people with MS, neurological diseases, cancer, where it may not be terminal, but it's debilitating and it's limiting their ability to live well.
So when you work with the elder community,
Yes.
what's a common factor as people get older in what they're looking for in care?
Well, not quantifiable, but part of what they're looking for is somebody who gives a damn about, who actually cares, not just a procedure or a treatment. That's part of it. They want to feel like they are being cared for, not just acted upon. Does that answer your question?
That's good.
Yeah. Peer support is important. Family support is important. But it's not infrequently that families disagree about what should or should not be done unto grandma or grandpa. And again, that's where your advocate comes in. I have seen many families disagree. And it's important that the person who has power of attorney trumps anybody else. The whole rest of your family could say, no, put her on a ventilator. And if you can't speak for yourself and your advocate says no, then you cannot be put on the ventilator, or you can be taken off of the ventilator, whatever the case may be. Can't think of other answers to your question, but sometimes we suggest that your advocate not be an immediate family member, daughter, son, husband, so on. I know a couple women in Tucson who they were the advocate for their mother, as it turned out, and their mothers had specified a lot of stuff to be withheld, and they honored their mother's wishes and enabled their mothers to have a relatively good death. They feel guilty still to this day. And the other reason not that your friends don't love you too, but the other reason to consider someone other than an immediate family member is it's one thing intellectually to agree to let nature take its course and allow somebody to have a natural death, but it's another thing emotionally to actually let them go. So that may not be the best choice, somebody that close to you. Again, not that your friends don't love you as well. So come to our advocacy training sometime. Learn all about it. But I'm trying to think what other patterns. Hospice care we recommend. Of course, you have to be terminally ill to qualify for that. But again, getting a second opinion, looking at all alternative or other possible courses of action is important. And a lot of people don't do that. They don't shop around, so to speak. It's like the same is true with funerals. You go to the funeral home that your family's been going to for years, rather than shop around, find the best price, the best environment for that.
So one of the things that said on the flyer was about looking for elder care attorneys.
Yeah, elder care attorneys.
Why is that important?
Well, it is important, and we have one we work with rather intimately, a woman named Elizabeth Smith, Beth Smith, and she is with Duffield so-and-so and so-and-so up on Sunrise. I have probably referred 200-300 people to her, and I've probably heard from a couple of hundred people how great she is. And they can help with making sure your affairs are in order, whether it's a trust, a living trust, a will, or a living will. Beth is very familiar with these advanced directives and whatnot. And it's important to, people don't want to leave a mess behind. So get your affairs in order. And an elder care attorney is a good place to start with that. Yeah.
So do people have any options where they feel like they're not getting the care they should?
Yes. If you find your wishes are not being honored, or your advocate does, Final Exit Network will sue on your behalf.
But if they're not dying,
Yeah.
but it's just their general care, they just feel like they're not getting their
Yes, you can fire your doctor anytime. You can, if you're in a hospice you don't like, you can, or you can ask for a different hospice worker, or get into a different hospice. You always and everywhere have the right to say no. And the alternative, if you're not getting the care you want, is to seek other deliveries of that care. Again, shop around, and ask and have this discussion before you're in a situation when you need it. Talk to family and friends, ask whom they've used, who's been helpful. Pima Council on Aging can be helpful in that regard too. But the most extreme care is alternative remedy is to sue. You can sue, but usually it's the people I deal with. It might be their estate that is suing because they have since died. But we will do that if your wishes are not honored. But regardless of end of life or not, you always have recourse.
It's good to know they don't teach you that.
No, they don't. They don't, and they want to keep you as a captive customer, so to speak. But you don't have to be kept. Yes.
I think there's so many of our elderly today that don't know they can say no.
Yeah, it's really important. You and or your advocate can always and everywhere say no. Any other concerns or questions?
Good.
My time almost up?
Yeah, simple but good.
Well, I hope this has been helpful. And I have a wealth of other information. If you want to contact me through BioTouch, I'd be glad to be of whatever help I can. Thank you.
It's always great, John. Thanks. All right.
May I give those of you who are here some handouts?
Yes.
Okay. This newsletter comes out quarterly. In the very front is a small insert with my contact information. And
Okay.
I have another document I want to give you.
I gave one, I'll go back and see Georgina, our service coordinator, that when they drove from the house.
Oh, okay.
She'd like to get you up there, and it's kind of busy, but it's slow right now, so maybe she'll be able to
Oh, have her give me a
get
call.
someone
Yeah.
in.
Here, give her one of these. And let me get one other document from that.
Okay. As John's handing that stuff out, we'll continue with our live streaming and teaching. So
Okay.
that was great information.
Excuse me.
Yeah. So we appreciate, you can go ahead. We appreciate these kinds of discussions because we're always learning something new. And so with this one, specifically what I like is how now can we use BioTouch along with what John was talking about. Thanks, John. We appreciate it.
Okay, thank you all. Best to you.
So yeah, truly, anybody who wants more information, what John does in the hospice program, especially online, you can contact us, and we'll hook you up with John. And he's quite knowledgeable about the whole hospice program and the elderly care. So what was nice about what he brought up was the advanced directive, and we actually had a person once who, in their advanced directive, put they want to make sure they get BioTouch. And it's interesting because a lot of people are afraid, I've learned in the medical system, to go into the system and do biotouch. Oh, they're not going to let me in, or I can't go into the operating room. And so to talk about it with our families and say, look, I want biotouch, because they might not even know that you're doing biotouch. So to have these kinds of dialogues, to have something like biotouch or massage or homeopathy or whatever, and to make it part of our directive, put it in our directives, and I think that was a powerful statement there, that we dictate our elder years and our dying days, and it's not about some system telling us what we have to do and what we can't do. So we do have a few sets of points. So what we always want to teach is, what is biotouch? And do you remember after taking the class? So these little workshops are designed to take out just a few sets of points compared to the whole class that you took about how to work with that specific condition. And our elderly care sets of points, one of the things he talked about is people just want to be cared for, not put upon. I mean, what a wonderful thing, biotouch. A biotouch which is simple, non-invasive. It can be done, and you even talked about some people don't want touch, but biotouch seems to be okay because it's so light and it's refreshing, and there's no level so that family members can learn how to do it. I mean, I remember when my father was sick in his elder days, and it was before he even went into hospice, that I did biotouch on him, and he had this neuropathy, and here I was touching my father's feet. Now, I wouldn't have really done that just to massage his feet. The sun kind of, even though we were real close, there's that, I don't know, it's my dad's feet. But I had no problem doing biotouch. And what I learned from that was biotouch made it okay to touch my parents. There wasn't a weird thing, even a son to a father or a daughter to the father, because it was for the purpose of care. And so what we're talking about here is elderly care, how to care for our parents or our loved ones as they grow older and they become more dependent on us. And how can we help them and give them strength? Because what we also find with biotouch is it enhances your well-being. It stops the isolation, that people feel. That's a big thing in elderly care. I mean, he talked about that too. They just want to have people around, and so many times in our elderly care situations, we stick them in a home or we stick them away. And I mean, imagine if we could bring biotouch into all these care homes around here, where you just did what we're going to show here, even just the greeting in a headset or something. So again, the nice thing about biotouch is as we go through this, there's no levels. Anybody can learn it. It's easy for the family to teach the grandkids. I mean, imagine the grandkids working on grandma and grandpa, and making that now part of our life, as we grow older, is to bring biotouch into the family structure. So there's no worry about hurting somebody. We just went to a homeopathic thing, and we thought, you could just take homeopathics, just take it for months if you want. But you actually, if you take homeopathic remedies for more than a few days, you actually could create problems, I mean, something we thought was so simple. With biotouch, we know you can't overdo it. You can't work on somebody too much. The problem is getting to work at least a little bit. I mean, we're talking about for elderly care, if we do once or twice a week with people, it's going to help them feel more calm. There's this accepting factor. People who get biotouch accept what is, and I think that's a big part. It's what do we have? We have all kinds of new terms for elderly care now. Do we call them elders? Do we call them old folks? Do we call, it's what's the right word to use? And so if we're all elders, then how do we honor our elders? There are some society, I know when my mother was taken care of by a Filipino family, they idolize their elders. That's like it is a blessing to be able to take care of your elders. That's not the way it is in this country. And so BioTouch can actually be brought into our elder care to honor our loved ones. But we don't have to get into the whole, we can still have a home or a caregiver, but it'll allow us to relate, the kids to relate, the grandkids to relate. So it's a nice complement to whatever you're doing, for our elderly care. And that could be pre-post-op that we talked about on one of the Monday shows. And there's no levels, we talked about that. Everybody's effective the very first time they do it. And there's nothing special that you need. So it can be done at home, it can be done in the hospital, it can be done in ICU, it can be done in hospice, it can be done in any setting, and especially the few sets of points that we're going to teach. So, any questions? Of course there can't be, because you're all pros at BioTouch. Any questions out there in La La Land? If you have questions, because all of us here have been doing BioTouch, just, emails is right there, office@justtouch.com. Go to our website, justtouch.com. Also, we have a new branding website, biotouchhealing.com. So if you can't remember Just Touch, you can remember BioTouch Healing and go to biotouchhealing.com. So we're moving up in the world. So what we like to do in this particular class is teach the few sets of points that we feel are the basics, and we teach from the basic sets of points so in this one there's 3 sets of points, and we're going to share with the whole world community and all of us, and we'll practice these basic sets of points that we're going to do. So again, we use the 2 fingers, the index and middle finger of each hand. We're going to lightly touch on the skin as if a butterfly is landing on you. And the points are done for 6 to 8 seconds. That's the basic thing. We wash our hands before we do the session. And if you don't have a sink, you can do that, or you can use whatever that stuff's called. Sanitizer or something. But it's not about a scrub down. It's just about, washing the hands or rinsing the hands. So that's all you have to do to start. That's how easy it is to start. And then we do a few sets of points. And the one set that we always do is the greeting. And we have a very special guest instructor today. Her first time on stage. Eileen is going to show us the greeting set here. So.
Are we there? Okay. So the greeting is the key to BioTouch. It seems to establish a harmony between the associate and the recipient. So the greeting set is performed before every session, before you address any of the other body parts, okay? And the greeting is also the only set in which you'll use one hand, and you're going to use your dominant hand. And if you're ambidextrous, just choose one hand or the other to do both points. Okay, so using that dominant hand, the first 2 fingers of that dominant hand, using a butterfly-like touch, touch greeting point 1, which is going to be in the fleshy area just below the bottom of the breastbone. So you're going to hold that point for 6 to 8 seconds. And then greeting point 2 is on the back side. To find greeting point 2, to find greeting point 2, you're going to locate the big bone at the base of the neck and go 1 to 1.5 inches to the left and hold that spot for 6 to 8 seconds. And that's your greeting.
Good job, Eileen.
stable?
Yeah.
All right, the next step we're going to do is metabolism. The metabolism set can be used to help the body assimilate what it needs and get rid of what it doesn't need. You can use it to address conditions such as broken bones, arthritis, weight loss, weight gain, abnormal growths in the body. So we're going to do, metabolism is done with what we call matching fire. In step 1, point 1 is going to be in the indentations on top of the collarbone on either side of the notch. Point 2 is going to be in front of the large muscle, halfway up the neck. And point 3 is at the top of the neck, in front of the large muscle. And that is step 1 of the metabolism set, using matching fire. In step 2, you're going to find your hold, which is going to be right. It's going to be 1 to 2 inches to the left of the breastbone. And then you're going to work the next points on the back. Throwing her all around. All right. These points are going to be located around what we call the breaking point, which is where the bottom of the ribs join the spine. Point 1 is going to be on the large muscle below the shoulder bone blade, and you're keeping your hold on the front. Point 2 is directly opposite on the large muscle on the right side. And it's 1 to 2 inches above that breakover point. Point 3 is going to be 2 to 3 inches below that breakover point, around waist level, but always above the hip. And then point 4 is on the left side, can be used to address blood sugar issues. And this point, if there is blood sugar issues, you can lift and repeat. You do not have to do the blood sugar point 4, but you have to do the whole metabolism set to do that point. Okay, and that is the metabolism set. She's coming off.
Okay,
And her head.
well, we need that on. So can you see it in the camera?
Yes.
Okay, so then a real key one is the headset. Even if all you can do is this step 1, which is A and A. So A in the front is at the forehead where the crown meets the forehead, this little ridge. And the other A is in the back at the base of the skull in the middle of the neck. Okay, that's A and A. If all you can do is the greeting and A and A, oh, I'm telling you, there's big stuff happens. I actually did some muscle testing stuff, and just doing A and A made a difference. So if we go on to go further, which this works on the whole brain system, the calming down, the pituitary center, the pineal gland, the whole neural center up there. When we had trauma last week, Jenny talked about this frontal lobe, back lobe connection. So it's really a powerful thing for this, for the elder care thing of just helping people calm down and feeling cared for. So then we do step 2. Are we still seeing it there?
Yes.
Step 2, you're looking for your hold point, which is an X, and it's at the base of the skull on the side of the large muscle. Pick one side, it doesn't matter, because then you're going to use your 2 fingers to touch the other side of the body. Point 1 is we're on this ridge line where the crown meets the side of the head. Point 1 is straight up from the corner of the eye on that ridge. Point 2 is straight up from the front of the ear on that ridge. Point 3 is straight up from the back of the ear on that ridge. Point 4, you're dropping about a third of the way down the ear, and an inch or two back you can feel an indentation. And point 5 is at the base of the skull, the side of the muscle, and you're opposite where your hold point is. That 5, which is really fun, becomes your new hold point as you work points. Oops. Chiropractic work. Point 1, straight up from the corner of the eye. Is it still on the screen?
Yes.
Point 2, straight up from the front of the ear. Point 3, straight up from the back of the ear. Point 4, about a third of the way down the ear and an inch or two back, that indentation. And point 5 at the base of the skull on the side of the large muscle. And then you just do all those again, except you do it in a matching fire. 1 and 1. 2 and 2. 3 and 3. You're all on this ridge line. 4 and 4, we drop behind the ear. 5 and 5, the base of the skull. And the final step, you just take your open palms, one of the only time we touch the whole hand on the body, and you cover points 1, 2, and 3. Any questions? Then we'll just show one more set of points and then we'll practice. The stress set, isn't that what's next? Stress. Stress is real simple, and all these things can be done with people laying down. They can be, they don't have to be up. I mean, I remember when I worked with my mother in a coma. I mean, I was just getting hands underneath and moving around. I worked on people walking around a room because the guy was in so much pain he couldn't stand in one place, and you just sort of walk around with him as you're doing it. So it's not that you need quiet, centered whale music, tingling cymbals, you know. You can do it on Pima Street. Stress, okay? Your hold point is the same point that Eileen told us about greeting point 1, just below the breastbone in the soft tissue. Now, it doesn't matter once you've done the greeting which hand goes where. So if I'm on this side, I'd be using my right hand for that hold point. But if I was on this side, my left hand would be touched. So it doesn't matter whichever side you're on. And now we're looking for an imaginary line, as it shows there in the book, that little dotted line goes from the notch at the top of the breastbone to the nipple where it would be on a youth. And there's that little line, and you divide that line into thirds. And the first third is point 1. And up that line, the second third is point 2. And you can just keep doing that back and forth. So again, whether you just do the greeting, or you do the greeting in A&A, or you can do the whole headset. Metabolism is good for the long-term care, especially if they have diabetes, to help the body metabolize what it needs, get rid of what it doesn't need. As we're going through our medical procedures, these 3 sets will really help in nothing else, the stress of growing older. In a Western society, for some reason, we've created getting old to be stressful. BioTouch can help us and our family live with a lot of integrity. Any questions about the points? about elderly care? Any elders in the community? Not me. So this ends our part of our live stream. Again, get hold of us at justtouch.com, and we're going to practice points.